Hello everyone, welcome to my image presentation. Today I'm going to be presenting to you guys two images of the thoracic spine. Um, these images include the lateral and the swimmer's view of the thoracic spine. I chose to do these images just because I feel like out of all the spine x-rays, the T-spine is one of the harder exams for me. So just to refresh myself by filling out the criteria for this image presentation has really helped me as I'm also presenting to you guys. So let's just get right into it. Like I said, the images that I'm presenting is the lateral T-spine and the swimmer's view for the T-spine. Some things you can keep in mind in terms of supplies for this exam. I would always like to grab an extra contact shield if I could, just to put behind the patient to reduce scatter. Um, some history questions that I like to ask the patients for T-spine x-rays are if they had any recent falls, any injuries to that specific part recently, and how long ago. Where is the pain specifically? Sometimes it can occur more on one side than the other, so I'd like to ask that, and of course, how long. And if they had any recent surgery, because that can affect the history in terms of if it's pre-op or post-op. You just want to know why you're doing the x-rays, so that's a good history question to ask. So why we take these T-spine x-rays, um, mainly for diagnosis of pain. So why the patient is having pain there, we can see it through the x-ray. If they have arthritic changes or arthritis, spondylolisthesis, which is the slipping of the the slipping of the vertebra, degenerative disc disease, when the disc starts to wear out just because of age. It could be from tumors, fractures to different vertebral bodies, herniated discs, abnormalities that are congenital sometimes, and the kyphosis of the spine. So this is my image of the lateral T-spine. And the centering for this image is perpendicular to the center of the IR at the level of T7. The CR enters posterior to MCP, so the posterior aspect of the thorax. This is my image of the swimmer's view of the T-spine. The CR enters at the intervertebral disc base of C7 and T1 and MCP. The central ray is also angled 3 to 5 degrees caudal if the shoulders cannot be depressed properly for this image. The anatomical body plane was MCP for this lateral T-spine image. It properly demonstrates intervertebral discs, intervertebral foramen, vertebral bodies, the lower spinous processes, clearly seen through the ribs. T3 to T12 is properly demonstrated, and soft tissue and trabecular detail. For this image, it would be on a 14 by 17 lengthwise, and the breathing instructions would include a breathing technique. The anatomical body plane the CR was entering was the midcoronal plane for this swimmer's view. It demonstrates the cervical thoracic vertebrae between the shoulders, appropriate penetration through the shoulder region, C7 to T1/T2, the humeral heads minimally superimposed over the vertebral column. I would also use a 10 by 12 lengthwise cassette, and I can either do this image on expiration or also a breathing technique. For this image of the lateral T-spine, there is slight rotation because you cannot see the intervertebral foramen clearly, and you can kind of see the rotation where the ribs come in through the posterior side. For this swimmer's view, you can see the junction between C7 and T1, and you can also see T2. The radiograph could have been collimated to the 10 by 12 size, but in this case, I think the tech just left the whole thing open just to show that they could get all 12 thoracic vertebrae. Since you can see what needs to be demonstrated on both the images, I believe they used a breathing technique. So that is when they increased the time and lowered the MA just to blur out the ribs and the lung markings when the patient is breathing normally to really bring out those vertebral bodies and the other structures that need to be demonstrated that are usually covered by the ribs or the lung markings. So we wanted that motion, so there is motion present. The films are not marked, and I do not know if that's because I took them off the internet, but they are not marked left or right. Usually for the laterals, we tend to do left laterals. So I'm guessing these are both done with the patient laying on their left side. Collimation is visible on both the images, but again, the swimmer's view could have been collimated to the 10 by 12 cassette rather than being open all the way. The technique used for the lateral would be, I'm guessing 70 at 10 to 25 MA at a 2 to 3 second time. Again, just utilizing that breathing technique. The S number for CR would range between 100 to 400. And if you're using DR, you want your exposure to be in the green with a 0.0 number, and that would mean that you had the best technique. It's not underexposed or overexposed in any way. For the swimmers, the technique would range from 70 to 80 kVp at 32 to 40 mass, and again, the range would be for CR 100 to 400, and your S number would be in the green. The photocell you can use is the middle photocell if you're not using the breathing technique, just because that's usually done manually. There were no repeats necessary, or from what I can tell of the images I took, there's no repeats necessary. So the pathology present in this lateral T-spine image is a mild compression fracture of T4 and a severe compression fracture of T11. So as you can see, where the arrows are pointing to is where the pathology occurs. And for this image, there is no pathology present. The image remains unremarkable. The critical thinking skills that needed to be utilized, I said if you cannot do a left lateral for these images, you can also use a right lateral. I know a lot of people like to stick to like what they know and what they practice in clinicals, but I've also seen it done as right laterals just because the patient could not lay on their left side and the images looked diagnostic. So the grade I would give these images would be an A. They demonstrated all things that needed to be there. There was good technique. The only thing is there was no marker, so I would give it an A minus if it was like an image I would have gotten off of PACS. But yes, I think just going over what needs to be seen for the swimmers especially is good to recap on. And yeah, thank you so much, and I hope you like my image presentation.